Thanks, Bob. Today, federal health experts begin sending out letters to people involved in the oil spill cleanup.
They want to know if the workers' health has been impacted by coming in contact with the oil dispersants. Sabrina Wilson is here with more.
And Nancy, it's a question a lot of people in Louisiana and 3 other states are asking, and now an unprecedented study will try to nail down some answers. It was a spill of unmatched proportions that warranted an army of cleanup teams. Now federal health officials want to know if the workers put their health at risk.
Our workers deserve to know that the National Institutes of Health, the experts in the nation on health and disease, are going to be looking specifically at oil and dispersants to ensure that workers are followed and looked at.
The environmental health arm of the National Institutes of Health is kicking off the largest ever study on an oil spill.
Gulf study will help us learn if oil spills and exposure to crude oil, dispersants, and fumes affect physical and mental health.
This week, letters are going out. Federal researchers want to reach out to more than 100,000 people along the Gulf Coast with a goal of having 55,000 of them actually involved in the study, which will involve physical exams.
Samples of blood, urine, toenail clippings, hair, and house dust will be collected.
Just turned it upside down. I have a 16-year-old which is at home. I can't do anything with her.
Helena Davis of Bridge City had no involvement in the oil cleanup or the fishing industry, but says since April 29th she's been ill with a disease that's affecting her appearance.
My doctor is saying it's a Bell's palsy that was induced by heavy metals.
She showed us what she says is a lab's test result showing high levels of benzene, xylene, and other chemicals. She and others are upset the study, which will monitor participants up to 10 years, doesn't involve the general public.
So I spoke to someone in the beginning, and she already told me I was eliminated from it because I didn't work in a cleanup.
If they're not willing to admit that there's a crisis now in health that people are experiencing, yes, I do question ultimately the results of such a study.
The head researcher insists they've met with at least one doctor who's been doing blood tests on people who suspect their health has been compromised.
When we talk about understanding the Gulf Coast, it looks at the effect of oil and the chemicals that come along with oil, things like benzene, as well as dispersants.
The study will also examine factors which could explain why some people are more likely than others to get sick. But scientists say those counting on the study to provide definitive answers on whether the oil spill maligned people's health may be out of luck.
We can never demonstrate exact cause and effect or have proof in this type of observational study
involving a spill that has thousands nervous. Federal researchers say other studies involving local health professionals will involve the general public. An example, LSU will partner with the NIH to study the health of cleanup workers and their family members.